To part 2 of lesson 5, we're going to go into diabetic emergencies. Diabetes is a condition that makes it difficult for the body to process glucose, which is sugar in the blood. A person with diabetes manages the condition with medication, insulin injections, or oral medications, diet, and exercise. If food intake, exercise, and medication are not in balance, the person may become ill because there's too little or too much glucose in the blood. For example, hypoglycemia is excessively low blood glucose levels, and this can occur if the person eats too little food, exercises more than usual, vomits, or takes too much medication. Hyperglycemia is excessively high blood glucose levels and can occur if the person eats too much food, takes too little medication, and exercises less than usual. The signs and symptoms of a diabetic emergency may include dizziness or shakiness, headache, cool, moist skin, changes in behavior, irritability, aggression. They're very argumentative. They are confused and disoriented, and lack of consciousness. Severe hypo or hyperglycemia can result in the loss of consciousness, seizures, and both may be life-threatening. If the person is known to have diabetes or requests some form of sugar and is responsive, able to answer the simple questions and allow sugar, you may be able to help by giving the person a small amount. Some people may be responsive but not able to safely swallow. In this case, do not attempt to give the person sugar by mouth. If it is safe for the person to have sugar by mouth, give 15 to 20 grams of sugar. Check the label on the packaged products to determine how much of the package contents to give. Acceptable forms of sugar include glucose tablets, candies that can be chewed, fruit juice, fruit strips, regular non-diet soda, milk, a spoonful of sugar mixed into a glass of water. Even if the person is experiencing hyperglycemia, which is too much glucose in the bloodstream, this amount of sugar will not cause immediate additional harm. Call 911 if the person is or becomes unresponsive, cannot swallow, does not feel better within about 10 to 15 minutes, and you cannot immediately find a source of sugar. Moving on to seizures. A seizure is the result of abnormal electrical activity in the brain, which leads to temporary and involuntary changes in body movement, function, sensation, and awareness or behavior. Seizures can have many different causes, including epilepsy, fever, infection, injuries to the brain tissue. Febrile seizures brought on by rapid increase in the body temperature, are the most common in children younger than 5 years old. There are different types of seizures. One common type of seizure is called a grand mal seizure. A person having a grand mal seizure experiences loss of consciousness, convulsions, which are uncontrolled body movements caused by the contraction of the muscles. And another common type of seizure is an absence seizure. The person experiences a brief, sudden lack of consciousness, and the person becomes very quiet and has a blank stare. Most seizures last only a few minutes, and the person usually recovers without any problems. So what should you do if a person is having a seizure? Let the seizure run its course. Remove any nearby furniture or objects that could cause injury to them and hurt their head or any part of their body while they're having their seizure. When the seizure is over, check the person for responsiveness and breathing. If the person is responsive and breathing normally, check the person from head to toe, looking for injuries that may have occurred during the seizure. Place the person in the recovery position if there are no apparent injuries. Stay strong with the person until he or she is fully recovered and aware of their surroundings. So make sure to just move everything out of the way and make sure they're safe while it runs its course. The following actions can cause harm and should be avoided: holding and restraining the person during the seizure, putting something between their teeth to prevent them from biting their tongue. You do not want to put your fingers near there and do not try to restrain them as it's happening. Call 911 if the seizure lasts more than 5 minutes or they have multiple seizures. If the person was injured as a result of the seizure. If the person is unresponsive and not breathing or only gasping after the seizure. If the person is pregnant or has diabetes. If the person is a young child or infant and the seizure was brought on by a high fever. If the person is elderly, this is the person's first seizure or the cause is unknown, and if the seizure took place in water. Moving on to fainting. Fainting is a temporary loss of consciousness caused by sudden decrease in blood flow to the brain. Some common causes of fainting include dehydration, being too hot, being in a crowded or stuffy room, intense emotion, low blood pressure, standing up too quickly after sitting or bending, over for an extended period of time. Some warning signs could be the person becomes pale, begins to sweat, dizzy, or weak. If warning signs and symptoms are present, it may be possible to prevent the person from fainting by having the person sit down and put his or her head between their knees or lie down flat on their back. All right, so the first thing you should do when a person faints is check for responsiveness and breathing. If the person is responsive and breathing normally, you should check the person from head to toe for injuries that may have happened as a result of the fall. Put the person into the recovery position if there's no injuries. Call 911 if the person is injured or if you have any concerns about their condition. Have the person follow up with his or her healthcare provider. And if the person is not responsive and not breathing and is only gasping, you should begin CPR immediately. Use an AED as soon as one is available if you are trained to do so. A stroke is a condition that can affect people of all ages. Although it's most common in older adults, young adults, teens, and children can have strokes too. A stroke occurs when blood flow to part of the brain is interrupted, resulting in death of brain cells. A clot may block an artery that supplies part of the brain tissue, leading to an ischemic stroke. A blood vessel in the brain may rupture, causing bleeding into the brain tissue and leading into hemorrhagic stroke. A stroke can cause permanent brain damage, but with quick action, sometimes the damage can be stopped or reversed. The signs and symptoms of a stroke can vary from person to person. A person who is having a stroke may show any of the following signs and symptoms. Trouble with speech and language, including slurring of words, being unable to form words, or being unable to understand what others are saying. Drooling or trouble swallowing. Drooping features on one side of the face, for example, the eyelid in the corner of the mouth. Trouble seeing in one or both eyes. Weakness, paralysis, or numbness of the face, arms, or legs, especially on one side of the body. A sudden severe headache, dizziness or loss of balance, confusion, and unresponsiveness. Some people may experience signs and symptoms of stroke that then go away. Even if the signs and symptoms go away, the person should seek medical attention because the person is at high risk for a stroke in the future. So, stroke, fast. So, F stands for face. Ask the person to smile. Is there weakness and drooping on one side of the face? Arm, ask the person to raise both arms. Does one appear to drift downward or appear to be weak? Speech, ask them to repeat a simple sentence, and do they have trouble speaking or is it slurred? And then time. If the person has a difficulty performing any of the actions or shows other signs and symptoms of a stroke, immediately call 911 or the designated emergency number. If you think if a person is having or had a stroke, make sure you call 911. Note when they first had their signs and symptoms so that you can report that to EMS personnel. And your last word today is the color blue.